Right. Hi everyone, my name is Flannery Currin, and I'm here to talk to you about how technology can help give caregivers a break. So I wanted to start off by showing this. The AARP put out this report on long-term care services for older adults and people with disabilities, and they ranked each of the states and DC, and as you can see, Indiana in 2017 was ranked dead last. So because care facilities, long-term care facilities like nursing homes, might not be quite up to snuff in terms of quality of care, lots of people would much rather keep people at home longer and under the care of family members or close friends. So that brings us to respite care, which is intended to provide family caregivers with temporary relief from caregiving duties. Sometimes they have their own health issues that come up and they need to have surgery, or they might just have to run to the grocery store, but their loved one requires 24-hour care. So that's what respite care tries to do. And so we've been interviewing caregivers, family caregivers, and respite care workers to see what issues each of those groups face. Family caregivers give examples like if something goes wrong and their loved one has dementia, they don't necessarily know what happened. They can't get that information from the care recipient, so that causes a lot of trust issues. Respite care workers talked about things like if they are in another person's home, they don't know that person's routine, they don't know where they keep things, they don't know how they want things to be done, so that can also be an issue. So in our research, we also came across an organization called Caregiver Homes. Caregiver Homes tries to help low-income family caregivers, and so they have care teams where family caregivers also have access to a nurse and a social worker who checks in on them. But unlike a lot of agencies and facilities that try to serve populations like older adults and people with disabilities, they use a web-based application for information sharing instead of a paper-based system. So they use the Vela Care app, which is HIPAA secure in terms of all communication. So family caregivers give daily notes with information on what happened that day, which leads to more effective care interventions. So the social worker and the nurse read over those notes every day and can cut in and say if they think something needs professional attention. And so where do we go from here? We are looking at adding other roles to that sort of communication, so adding temporary workers, respite care workers, or maybe including the care recipients in that process, increasing offline functionality to reach some people in more rural areas who have less reliable internet connection, and then building in new functions, so potentially a support group or things like that. So that's where we're at right now.